Hello everyone, I am Akash Kanti, second year MBBS student. Today I am going to discuss about the lobar pneumonia. Firstly, we have to know about what is lobar pneumonia. Lobar pneumonia is a severe form of pneumonia that affects a large continuous area of one or both the lungs. Unlike bronchopneumonia, which appears in patch distributions, lobar pneumonia causes the consolidation of an entire lobe, making it a distinct and often more acute presentation of lung infection. Here, unlike bronchopneumonia, lobar pneumonia causes the consolidation of an entire lobe of the lung, which makes it into a distinct and often more acute presentation of lung infection. Lobar pneumonia is typically characterized by fibrinosuppurative inflammation, which leads to a distinct radiological findings and a more uniform clinical course. Here, fibrinosuppurative inflammation refers to an inflammatory process which is characterized by the presence of both fibrin and the pus, typically indicating the severe acute inflammation and the infection. Now, we are going to discuss about the etiology of lobar pneumonia. Most common cause for lobar pneumonia, that is Streptococcus pneumonia. Streptococcus pneumonia is the most common cause for the lobar pneumonia to occur. Streptococcus pneumonia accounts for majority of classic lobar pneumonia cases, and it also produces the typical four-stage pathology. Other bacterial causes of lobar pneumonia are Klebsiella pneumoniae. This Klebsiella pneumonia is seen in alcoholics and diabetics, and it also causes the severe and necrotizing pneumonia. Klebsiella pneumonia causes the severe and necrotizing pneumonia. Then Staphylococcus aureus, which is often a post-viral infection, and it's going to cause the complications like abscesses. Staphylococcus aureus is going to cause the complications like abscesses. Then the Haemophilus influenza, which is commonly seen in COPD patients. Now we are going to discuss about the pathogenesis of lobar pneumonia. First, we have to discuss about the entry of an organism. Infection usually caused by the Streptococcus pneumonia. The lobar pneumonia is usually caused by Streptococcus pneumonia. These organisms reach alveoli through the inhalation of droplets or the aspiration from the nasopharynx. The organisms reach alveoli through the inhalation of droplets and the aspiration from the nasopharynx. The predisposing factors are alcoholism, smoking, viral infections, and immunosuppressions. These four are the predisposing factors of lobar pneumonia. Then, after the entry of organism, it gets multiplied in the alveoli. Once the organism enter the alveoli, it get multiplied in the alveoli. That is, the bacteria multiply rapidly in alveolar spaces. In the alveolar spaces of the lung, the bacteria going to multiply rapidly. Then Streptococcus pneumonia capsule. The capsule of the Streptococcus pneumonia prevents the phagocytosis. The capsule of Streptococcus pneumonia will going to prevent the phagocytosis, which will protect the bacteria, and this also leads to the accumulation of organisms in the alveoli. This leads to the accumulation of organisms in the alveoli. Now, the inflammatory responses. Alveolar macrophages releases the cytokines like interleukin 1 and fever chemokines which attract the neutrophils. The increased vascular permeability which leads to the exudation of protein-rich protein-rich fluid, neutrophils, and RBCs. Then this infection will going to spread within the lobe. The infection spreads through the pores of cone, that is the intraalveolar connection. The infection spreads within the lobe through the intraalveolar connection. Then it leads to the uniform involvement of a lobe. Then it leads to the uniform involvement of a lobe. Now we are going to discuss about the stages of lobar pneumonia. There are four stages of lobar pneumonia. The first stage is the stage of congestion. The second one is stage of red hepatization. The third one is gray hepatization. And the fourth one is the stage of resolution. Now we are going to discuss about one by one. Now, the stage of congestion. Stage of congestion, we are going to see the gross features. Here, the lung is heavy, boggy, and red. In congestion stage, the lung becomes heavy, boggy, and red in color. And it also shows the vascular engorgement. It also shows the vascular engorgement. The cut surface oozes blood-stained fluid. The cut surface of the lobe oozes the blood-stained fluid, and the microscopy of stage of congestion. Here, the dilated and congested capillaries are seen in alveolar walls. In alveolar walls, the dilated and congested capillaries are going to be seen, and alveolar edema will going to occur. Protein-rich fluid. Few neutrophils are also present. Numerous bacteria will going to present, and RBCs may start appearing in alveoli. In stage of congestion, the RBCs may start to appear in alveoli. And then the second one, the stage of red hepatization. The time duration. The stage of red hepatization will going to occur after the second to third day of the illness. It will going to occur after the second to third day of the illness. Now the gross appearance. Here the lung becomes red in color, firm and airless. In red hepatization, the lung going to becomes red in color, firm and airless. This consistency resembles liver, hence hepatization. In stage of red hepatization, the lung will going to resembles like a liver, hence the hepatization name is given. The cut surface is dry and granular, and the microscopy. Alveolar spaces filled with RBCs, neutrophils, and fibrin. The spaces of the alveoli are going to filled with the RBCs, neutrophils, and the fibrins. The capillaries remain congested. The capillaries are dilated and congested in the stage of congestion. In stage of red hepatization, also the capillaries are remain congested. Numerous bacteria are seen in the stage of red hepatization, the commonly Streptococcus pneumoniae. Now, the third stage, that is the stage of gray hepatization. The time duration, it will going to occur after the fourth to sixth day of the illness. The stage of gray hepatization will going to occur after the fourth to sixth day of the illness. The gross appearance. Here, the lung becomes grayish brown, firm, and dry. In stage of gray hepatization, the lung going to becomes grayish brown in color, firm, and dry. The cut surface is dry and granular. The color changes from red to gray due to the breakdown of RBCs. In the stage of gray hepatization, due to the breakdown of the RBCs, the color of the lobe of a lung is changes from red to gray. Then microscopy, alveoli filled with. Here, the spaces of the alveoli are get filled with neutrophils, fibrin, and disintegrated RBCs, that is, decreased intact RBCs. Macrophages are going to appear in the stage of gray hepatization, uh, and capillary congestion reduces in stage of gray hepatization. Next, the fourth one, the stage of resolution, time duration. It begins around the eighth day onwards. Stage of resolution begins around the eighth day onwards. Cross appearance. Lung gradually returns to normal spongy consistency. Here in the fourth stage, the lung gradually returns to its original or normal spongy consistency. Exudate which are present are now gets cleared. Exudate which are present in other three stages are get cleared. The color of the alveoli becomes pink again. Microscopy. Macrophages predominate in the stage of resolution. In alveolar spaces, macrophages are predominant, and also enzymatic digestion of fibrin and exudate takes place. The debris are cleared by phagocytosis, that is by macrophages, and expectoration, coughing out. Expectoration by coughing out. Alveolar architecture is restored. Alveolar architecture is restored. Now we are going to discuss about the diagnosis of lobar pneumonia. In diagnosis of lobar pneumonia, we are going to learn about the clinical features. What are the clinical features? What are the lab investigations? Blood culture and the chest X-ray. The first one is the clinical diagnosis. In clinical diagnosis, we're going to see the sudden onset high fever with chills and also the productive cough, which is with rusty sputum, which is classically due to the Streptococcus pneumonia. Pleuritic chest pain is also present. Dyspnea is also present. The signs of lobar pneumonia. Bronchial breath sounds are seen in lobar pneumonia. Dullness and percussion is seen, and increased vocal firmities also there. What are the signs that are seen in the lobar pneumonia? Are bronchial breath sounds there, dullnesses and percussion is present, and increased vocal firmities is present. Now, the laboratory investigations, blood test. In blood test, leukocytosis will go into scene, that is increased neutrophils is seen, and there is also increased C-reactive protein and increased erythrocyte sedimentation rate. And in the sputum examination, that is in the gram stain, gram-positive diplococci is seen, which suggests the Streptococcus pneumoniae, and the culture confirms the organism and antibiotic sensitivity. And in blood culture, it may detect the bacteremia in severe cases. And in imaging, chest X-ray. Through chest X-ray, we are going to see the homogeneous lobar consolidation. Going to see the homogeneous lobar consolidation and air bronchogram sign, which is classic. Advanced test. If it is needed, we are going to do the advanced test for the lobar pneumonia. If it is necessary, then we are going to do the advanced test. Those are PCR for organism detection. We are going to do the polymerase chain reaction for organism detection and also the pleural fluid analysis. If any effusion is present, then pleural fluid analysis is done. And then the treatment for lobar pneumonia. What are the treatments are given to the lobar pneumonia? First, the antibiotic therapy. In antibiotic therapy, if the disease is mild, then amoxicillin or azithromycin is given. If the disease is mild, or whether uh, the patient comes in the OPD, then we are going to then amoxicillin or azithromycin is prescribed. If the disease is moderate or the patient is hospitalized, then ceftriaxone with azithromycin is given. If the case is severe, that is, the patient is admitted in the ICU, then ceftriaxone with azithromycin is given. And supportive treatment is also done by giving oxygen therapy, antipyretics, example, paracetamol is given, hydration, and cough management is also done to support the treatment. Then, how is the lobar pneumonia or how can be lobar pneumonia get prevented? Lobar pneumonia can be prevented by giving the vaccines like pneumococcal vaccine and influenza vaccine. And by doing smoking cessation, we also prevent the lobar pneumonia. Okay, lobar pneumonia can be prevented by giving the vaccines like pneumococcal vaccine or the influenza vaccine. By doing the smoking cessation, we also control the or we also prevent the lobar pneumonia.